recording it, so if you have any trouble with that, just let me know. I want to share my screen and just jump right into the COPA system because that'll help us walk through a little bit. Obviously, you sign in like normal. I did want to say, let me go back. I apologize. We did just add the benefit enrollment survey. Is everybody familiar with that? I want to bring this up to start. It's a pretty big deal. Part of this receiving this funding is it is a research project. It is a research grant in that sense. And what they're attempting to do is to say, we want to increase dollars for diapers in the future across the nation, but just trying to figure out what is going to be the best way to deliver that. What is the best system? So we're not the only state operating this. I think now there's probably up to about 20 or so states that are doing it, 25 states that are delivering this, and everybody's doing it their own way. And that allows them to kind of study what's the best way to deliver this program. So part of that is obviously being able to get information. And we all know that being community action agencies and other type of deliveries, there's always got to be some sort of documentation or research so that we can continue to receive the funding. It's no different with us in the same way. So one of the most important things that we have to increase and be able to get is the benefit enrollment survey. It is currently both in English and Spanish. If you need another language, please let me know, and we'll put that on there. We just put it on this original screen, so when you sign in, you should be able to see it. Or before you sign in, it should be there. And all you have to do is click on the link, and let's see if it works. Didn't even test it. Yes, and it's a basic SurveyMonkey survey, and this is for the client to take. So you need one per each family. They may give us another one towards the end to see if things change. I assume we'll get a secondary one towards the end of the program that everybody fills out. So if you have folks that are receiving services now and they have not filled this out, please work with them. What we have found the best method to do that is to have them fill that out when they're there on site, because the majority of our families either won't have access to be able to do it because it is an online survey. It's, and so they'd have to have access to the internet. And or they tend to forget to do it later on. So please work on this and have each family fill it out once. They only need to do it one time. They don't have to do it every time they come, just the original time. So have them fill that out. And it asks questions, and I know it's duplication because a lot of this the questions we had already, but please have them go through there. It really only takes maybe about 10 minutes to do. It's a little bit lengthy, but not too bad. And it's pretty questions that they can answer fairly quickly. Is there any questions on the benefit enrollment survey? So the links are there. I can email you the links if you need to. Obviously, you can pull them down from there as well. You're more than welcome to send them out to your families to see if they can fill it out that way. But if you have them coming in to pick up diapers, please make sure that they stop and fill those out. We've got to get those numbers up for folks that are enrolled. So any questions on the enrollment survey? That is not, they supposedly will give us the information on those. That's not anything that comes to us. It goes directly to the feds. What they're doing with the information, I don't really know, but I'm sure they're doing some kind of study or some kind of research on it. So, and yes.
I'm sorry, I do have a question. Will it record if the family's taken the survey, or do we just have to take note that that family has taken it?
Yeah, we could just take a note that you believe that family has taken it.
Okay.
And all we get is a report of how many families have taken it.
Oh, okay.
That's what we'll know. I do believe in one of the questions in there, it will tell us which agency it's coming from. Right now, I asked them, I said, well, how many do we have filled out? And they said 1. I said, oh, okay.
Okay.
So and I said, well, that's on me. I didn't explain it very well. And I said, I didn't send it out, again. And I said, so this is just a chance for us all to kind of catch up on those. I do believe when I get the report, it will be able to tell us which agencies they're from. So I will send that out to each of you guys. Just letting you know, this is what you say you have enrolled right now, but this is how many surveys we have. So you just kind of have an idea. So yeah, just an internal case note, just trying to do the best we can. I will say it's not mandatory, but it is very, very, majority of the phone calls I get from the feds are about those surveys. I'll just tell you that. That's what their biggest piece is. So, so great question. Great question.
Okay, thank you.
But I will pass along any information they give me. I'll send it to you guys so you know where you're at. So a couple of things. First of all, everybody's doing great. I know some of us are at different stages. If you need anything, if you need a new access, or if you need someone else to have a login, please just let me know. A couple of things I want to make sure that we're aware of. Obviously, when the family comes in, The first thing you're doing is getting the basic demographics that you can, the best way you can. I'm going to use a family, so please nobody memorize who this family is. But when you come in, obviously there is the basic information that you're going to fill out. If you got any questions about that, Emma will be able to help us through understanding where that's at. But one of the first things you need to do when you do start with a family and get all this information is you scroll down here where you see where it says primary caregiver enrollment information. You need to right here, make sure that this family is receiving services. So once you get all that information, what this really does, it's like connecting the power to the house, right? So we can't go in and flip any light switches within the house if we don't have power to the house. So the way the system works, it says we have to start, this whole household is now receiving services. Regardless of what the services are, all we're doing is saying this household is currently receiving services from us. Does that make sense? So please make sure if you go through your families and look at that primary caregiver enrollment information, you click on that little pencil and it'll let you do it, right? It'll let you, oops, excuse me, I did that wrong. Right here where it says activity. If it didn't have it receiving services now, I don't know why I'm pointing, you guys can't see me pointing at this, but if it didn't have them receiving services now, that would allow me to start services. Obviously, this person is currently receiving services, so I could discontinue services. Don't worry about that right now. We'll do that towards the end of the program. And that's how we know that someone has started and stopped. But currently right now, they are receiving services. So you want to make sure and click that on there so that turns it on. So all the tracking that you do won't work if the family's not receiving services. It's not turned on, essentially. Emma, do you have a comment there? Oh, you're muted.
I apologize. Thank you. Looking at this particular family, I want to point out to please do not, when you're creating the application, it takes you to the income page. And on the very bottom, it tells you proceed to add child application and proceed to add with no child application. Make sure that always select no child application. This family has, you added Saraya Acevedo as a child eligible. You guys are not providing early education services, so please add those any children to as a family member, because otherwise this child is not going to count as your family member. Okay, so it's very important to add them as family members, not as children, eligible children. You guys will ignore age eligible children because you're not providing early education services, you're providing other services. So when you create the application, you go to the income page, and then on the very bottom, select the one on the right, the option on the very bottom, proceed with no child application, please. Do not create a child application, because then this child is not going to count as a family member.
Does that make sense, everyone? So if you've done this now, no problem. Just go in and correct it. That's what I love about this system. There's never an issue. You can always go in and take something out and correct it really easy. So again, every family member needs to be under the family member list. We do nothing with age eligible children. And I get that that's confusing because you're saying, well, this child is age eligible to receive diapers. That makes sense. But that is for the Head Start or early childhood education side. And we're not enrolling these families in Head Start. Now, if you'd like to purchase the system and start tracking Head Start, then you can talk to Emma. She can tell you. But currently, this system right here, we're using just for the family member list. So on this family, Mercedes would be able to go in, easily click the pencil and add this child to the family member list. And then you can just delete this. Does that make sense? So everybody goes on their family member list. So those are two things that we've seen so far. Is making sure that we turn on the family, we start the services, and then we list every child under family member list, or every family member that you have a record for.
I have a question.
Yes.
Okay. In our resource center, we have families that we provide services for in the outlining communities, which some communities are 20 minutes away, some are 30, some are 40 minutes away. We have found that some families are unable to get transportation. So they're calling us up and they're asking us, can we enroll over the phone? We're taking their applications over the phone, we're enrolling them, but we have not provided the service on those applications. So if you look at some of ours, there is not a service received because we have not given them their diaper kits. Now they are telling us we're going to come into the office and we will be picking up our diapers. So is it just easier? I don't want to say I guess what I'm trying, I don't want to say we already gave them their diaper kits when in reality they have not received them yet, but they are enrolled in the program, and at any moment they'll be calling us and saying, I received transportation, I'm going to be there at 2 o'clock today. When they come in and pick up their kits, then we put in the received services. Is that going to complicate things?
No, absolutely not. And I promise I didn't plan Anita to ask that question because that is the perfect question about what we're going to talk about. One thing I want to hit on before we jump right into that is do remember that they have this parent pool as well. I know this doesn't necessarily solve the issue, but there is ability to send them this link, right? So if they have internet access, if they, you say, hey, you can't come in, do you have an email? Do you have internet access? You can have this link, which will allow you to essentially send them the information, and they can create a login and they can fill a lot of this information in for you. So just want to throw that out there too for everybody. And again, I know online systems are not a solution for everyone because you got to have internet, but just remember that it's there, kind of slow, lower some of your workload of having to enter all that information, lets them start the process. So that's number one. So let's answer your next question, Anita. Okay. So let me stop these pop-ups just a second. It's just giving us information. All right, so we're on that family. So to what you're saying, Anita, is first of all, the family comes in. We're still turning on services because the first thing that you do is once you pick up that phone and you're starting to talk to that family, and you're getting all this information, at that moment, you are providing them service. Now, just because you're not providing them diapers, the household, again, has to be plugged in. We are starting with this household. This is now a community action household, and they belong to us, and we were working with them. So we go down and we start, right here. We want to start that. So you still want to go ahead and say, I've started services. I'm working with this family. I'm going to attempt to make them eligible. So then we move to that. So that you turn that on regardless if they've ever received a diaper or not. I've started with this family. I want this family to be one that I track. So then the next piece is, let's talk about that. So what is the first thing that you do for a family? Well, the first thing we do is make sure that we determine that they're eligible, right? You've gotten all their intake. You're going to determine that they're eligible. Well, we have to track that because that is a process. So to your point, Anita, the first thing you would do is I'm going to go in here and actually add that family service. Again, this is under the family service tracking button. Everybody see that? The family service tracking, when you check on it, the first thing you're going to do is you're doing the DDDRP program, right? The diapers program is what you're trying to do. So the first thing that you're going to do is eligibility determinations and referrals, right? So that's all you've done. You've not given them any diapers yet, but that's the first thing. So every family, when you first do this, you have to mark this down. Now, the good thing is you only have to do it once. And you can see here in this family, let's see if I can get it to go back. See right here on this family, the first thing right here is they received eligibility determinations and referrals. There's no outcome with that. It's just a simple service. And what that does is it allows me and all of us to have an idea of how many folks you do have, not necessarily how many have received diapers, but how many you have enrolled currently. So that's the first thing. So what's the next thing that you may do? Well, you may decide you're going to do case management. You may decide that you're not going to do case management. But if you decide to do that, we're going to talk about that assessment. Then that's the next thing you're going to go in service type. It's under the same thing. DDRP, you're going to set the outcome with it, was individuals who achieve one or more outcomes in various domains. Why is that? Well, because that tracks the fact that we're trying to give them multiple services, right? That tracks something different than the actual diapers, which is I'm providing case management activities. That's a part of this grant. It's not just the diapers, it's the wraparound services as well. So by you performing the family well-being assessment, by you talking to them about all the different services they can receive, we're going to track those specific services when we get to them. But in the meantime, the actual process of doing that, we want to get record and account for that. Does that make sense? So it's the beauty of federal dollars. Nothing's done if you don't track it. So the first thing you've done is eligibility. You're tracking it. I'm doing case management. I'm doing the well-being assessment with them. I'm working on all these other things. The act of actually doing that, we need to track it too. So we want to have it. Then we get into the diapers. Eric, I see you got your hand up.
Yeah, I had a question because originally we were putting diaper case management for everyone, and we need to go right on remove and just want to confirm, and then we're going to add that diaper eligibility for everyone. So we're going to have to go and manually change all of that, right?
Correct, yes.
But we do have family like with first five that we do full case management, which it's not, it's going to be just a small portion of those clients. Are you wanting us to then, because it's diaper case management, but or is it just any case management to track those CSBG services? Because I guess the more service we provide to those clients, I mean, you want us to start tracking, correct?
Correct, yes. So and we do a lot of this work naturally, right? Somebody comes in and says, well, I'm here, but I also need energy assistance, or I'm here, I need housing assistance. And we're really quick to just give the service, but we definitely do need to track it. So correct, if it's a family, they're enrolled in this program, even if maybe they're a Head Start family and you're working with them at Head Start, we'd like to have that information here just so that we can say, hey, this family's also getting this. This is part of the program, is being able to track that. And one of our advocacy efforts has been, this is why Community Action is so good at this, because not only can they come in and get diapers, but they can come in and get Head Start services and energy services and all this other stuff when they come to our agency. And so it's just trying to, and I know you may have families that work with multiple social workers in your agency because they're enrolled in multiple different programs. It's just trying to get as much information and have it in one spot. That's what we're trying to do. And I know that could be some duplicate entry, and you know, that part I really don't like, but it is what it is right now, because this is our way, and I'll show you why in a minute. This is our way to be able to tell our story about all that a family receives. So yeah, so the first thing is being able to say, look, we do case management activities. I talked about all these other programs that they have. So I want to talk about that, and then we'll come back into the diapers as well. Again, the eligibility determinations and the case management, you really only need to enter that the first time that they come. So you only need to put that in there once, and you don't want to stop that service end date. The service end date can be ended on eligibility determinations. That's fine, because you're only going to do that once. You start and stop it. I'm done with that. That ended. Case management, I would leave it open for now, because they're going to keep coming back and you're going to keep having additional conversations, and you don't want to turn that on and off, because there's no sense in entering it every time they come. Just enter it the one time, leave it open. And then when we get to the end of the program, we'll go through and start shutting all those off so that the service is ended when we get there. All right, so then the next thing we're going to do is obviously talk about that case management. Let me do that first, and then we'll come back to the actual tracking of the diapers as well. So just a reminder, is each family has an opportunity to have a family assessment. So you click on family assessment right here, and the tool that we're using is called the Family Wellbeing Assessment. When you click on that, you'll see here, this one's done, and then another one can be viewed 6 months later. You can use this as often as you want. We can put more in there so that you can assess them as many times as you'd like, but we do want to make sure there's one at least baseline assessment when you first start working with them. And then we'll have one assessment at the end of the program as well. And what we'll be able to do is take that first assessment and that last assessment and measure them and see if there's any growth. And we'll be able to tell our story collectively of all the families that you serve. But it's also a tool so you can understand other areas of interest that they may need, other issues that they may have. So each one of these has a question. Of course, the first question is diapers, right? This is real simple, tracking those. But we'll go on to the other ones. The next one is food and nutrition. For each question, you'll see a guideline here. So let me click on this pencil here. So I click on the pencil. If I click down food and nutrition, now it just says all these areas, but that doesn't necessarily tell you anything, right? What does stable mean, right? Well, if I click on the guideline, stable in this category means that individual and family are able to afford some food, occasionally use of food bank, pantry, or vouchers, but does not receive food stamps. So it has a very, very direct definition for each one. If I look at energy, utilities, right? They have them stable here. So what does stable mean? Well, in this category, stable means able to pay all utility bills with established payment plan, right? If I have somebody come in that has a utility shut off, they would be in crisis when I first served them, correct? Right? Utility shut off, unable to pay all bills. So I would put them in a crisis, and I'm going to tell you what that means later. Does that make sense? So let me go back. I don't think I changed anything.
There's two numbers for each guideline. Like it was number 5 twice, number 6 twice.
Sorry, this was actually complete. I'll say that again. I'm sorry, Eric.
For like when you went to those different level, like
Mhm.
in crisis, there's 0 and 1, 2, 3 level. Within each level, there's 2 numbers.
Yeah, within each guideline, there are multiple ones, and it'll give you the number beside it
Okay.
too. Yeah, so for example, on this one, which is this is, I'll show you a big one here that's really helps look at.
David, I can go ahead and make it much friendlier for them to choose the correct number. I'll hide the ones that, because each stable has its own number, and each safe and thriving and everything has a number that corresponds to that particular question. So the one that doesn't apply for that particular question, I'll go ahead and hide it. I'll fix it for you.
Okay, perfect. So that way you don't necessarily have.
So that way they only see one vulnerable, one stable, one safe, one thriving. Okay, I'll do it.
Well, and one thing I'll say too is there are different levels though. So like in crisis, okay, well, in crisis on a housing scale has more than just the 5 areas. But under crisis, it may be in crisis 0, which is homeless.
Yeah, you're right.
In crisis 1, which is substandard or unsafe housing. Right? In crisis 2 is home in foreclosure or living with relatives and friends due to crisis. Does that make sense? So they're all still kind of in crisis. It's as defined as the way that we defined it. But there's can be different levels, but that's not the case on all of them. You know, when you look at food and nutrition guidelines, there's only a few, right? So there's only 0, 4, 6, 8, and 10. So those other numbers may not pertain, but that's what that number, does that kind of answer there? So you're right. Some of them you don't need on each one. It was just kind of simpler in the system to have it that way. Does that make sense?
Do you mind going real quick to the data sheet of Josephine? If you go back to the data sheet, I did something for them so they can scroll down to where the child was, right here where the child is. You see how you have a little cross next to waiting?
Mm-hmm.
That way they don't have to retype everything. Go ahead and click on the cross.
Oh, that's
and then just go ahead and submit it. And that will add the child as that you're done. You don't have to retype the whole entire thing. I just did that for you right now. So if you go back to the data sheet, click on data sheet. If you scroll down, you will have that child as a family member now.
Emily, you're my hero. I appreciate that. We all appreciate you for doing that.
Yes, that way you don't have to like retype everything. You can leave the child there. It doesn't make any difference because the child's not going to count nowhere. What we want to do is him to count as a family member. Okay, so if you see any data sheets that has a child under early education, go ahead and just click on the waiting list, click on the cross and make him as a family member, okay?
Everybody good on that? So that makes it easy if you've got some in there to convert them over. All right, so you completed the assessment. And one of the things that I really like about this system, oops, wrong one, is make sure case history. So one button I really like is case history because it puts everything that you've done for the family together in one spot. So once you've completed the assessment, one of the things that you're able to do is click on that. Let me find another family here real quick to see. It may actually be a little bit less. All right, just going through family assessment. We're going to check, see if this one was done yet. Okay, I do. Let me go back. Oops. Check this one, see if it's a little different. Just looking at the family assessment, you can obviously use it. In theory, what should happen is when you have a family here, you see here, this one's all different levels. So let's go. And one of the things that makes it really easy is clicking on case history and saying, what is it that I want to work on this family with, right? We know we're going to give them diapers, but what is it I want to work with this family? Well, when you click that case history, it really quickly will put you things right here, areas of concern and need, areas of strength, right? It's considered a strength if it's in that thriving in those top 2 categories. It's considered a concern or need if it's in crisis or vulnerable, right? And so what this does, it says, well, we obviously know they're vulnerable for diapers because that's why they're here to begin with, right? But also I see here they're vulnerable in food. So then I start thinking about, or are there some other outcomes, or there's some other goals under the family services that I want to do? So this is where we start the case management, and I'll come back to that in a minute. But it puts it all here for you really easy. So I'm talking to the family, and it says, well, based on your current housing situation, I can see that you're in crisis. What other services do we have, or do our partners have, that I want to either refer you to or set you up for, so that we can begin to work on that and setting the goal to get you out of crisis in your housing situation, right? Doesn't mean it's necessarily going to happen, but since we're in the beginning of these families right now, we're starting to set those goals for other services that they can receive beside diapers. And I'm going to show you that in just a minute. So you've done the survey. Now you say, okay, I want to make sure and get your diapers set. That's the first thing, because that's what you're here for, right? That's the presenting issue. So again, we go back to the family service tracking. Oops, let me go back to, let me go back to the first family. So on this one. So what you would do then is you go in again, you click the pencil and you can add the service. You can see this one right here has been added, right? This is a diapers child size 5. I'll show you this program type. Again, it's under the diapers service types. You have all the different sizes, child size 1 and 2 in wipes, 3, 4, 5, 6, all in here, and you can add that in. So one of the questions that has come up a couple of times is, why am I providing that service? This is using the community action model, which says there's a reason to provide every service, correct? Well, ultimately in this, it's for the child in the sense that we're trying to demonstrate improved physical health and well-being. So we want to click that outcome, right? We want to click that because there's a reason why we're giving them diapers. We're having a goal for them. We want to improve their physical health and well-being of the child, okay? So then the CSB service type, right? We're marketing as kits and boxes, because there is no diapers under the CSBG. So that's how we're tracking the actual CSBG. We're just linking it there. So all you do is the only one that you can click, and click on that, right? So then you're going to start that and you're going to hit submit. I'm not going to do it on this one because I don't want to put it in there, but I'm going to show you where they have it in here already. So that's all I do. When I hit that, it shows up diapers child size 5. Now, how do I track that without having to do that multiple times? So you've decided this family currently is receiving size 5. You don't have to re-enter that every time. One thing that's really, really important is that you started that goal. We're not going to mark that goal as achieved yet because we don't know that. Just because we hand somebody diapers doesn't automatically assume that we've improved their physical health and well-being, right? So currently the goal, the outcome is set because that's our desired outcome, but that doesn't mean it's necessarily been achieved. We'll come back towards the end and start marking based on, our follow-up with them, whether that was achieved or not. In the process now. So we've started that service for diapers. So then we need to decide how often they come in. So you can see here, this child has come in twice. This is what we call family service items. So you have started that family service specifically for child size 5 diapers. Now, each time that they come in, all you have to do is go to the items question. So again, the first time they came in, you put this in for child size 5. You're just going to click these little buttons on the far right. And it says items. So this is where you're getting very specific in each one of those items. And then all you do is click here, you put the date in. Let's say they came today, the service item that they got the 5 provided by, you can, enter that in if you want to, how many they got. They're getting 2 packages, right? It's a kits right here. So you select that. Also, we do have a value now. I apologize, we didn't have that before. And just want to make sure I'm right. I believe it's $20 is what we're putting in there. And that just kind of gives you an idea of what the average value is. Just helps us really easily make a report. So you just would put in the $20 there. They're getting 2 quantities of it. And then if you hit submit, it's going to show up like this right here. So when I run it, and I'll show you the reports, what it looks like and what it'll show you. So questions on that. So you would hit submit. That's it. All right. So then when they come back next month, I don't have to put in the whole item here. I'm just putting in the unit. Does that make sense? So first thing we did was eligibility. Then when we start assessing them, we want to track that we did an assessment and we're showing that work. So we're showing the case management and then we're going into the diapers. So if they start out the first time they come, it's maybe size 3, right? And then every time that they come back and get those 3s, we're just doing it as an item. And then let's say after about 4, 5, 6 months, they're now in a size 4. Well, then you would go in and say, okay, well, we're changing them to a size 4 now. So I need to redo this. I need to do another one because now they're in 4 and I want to show that that's how they got 4. And I'll be able to see that progress, right? They came in, they started out as 3, they went to 4. By the time they were done, they were in size 5. And this is how many individual times they came in. So again, the first time a little heavy on the front end, but after that, it's kind of settled. So now any questions on that before I move forward? That's going to give us a basic report. Now, what's good about that is every quarter when we have to turn in information, and we've got one coming up at the end of this month, is I don't have to ask you for reports. I can go in here and hit a couple buttons and I pretty much have all the information I really need to have. So there'll be no reporting that you have to do. It'll give it to us right away. We have all that in there. So let's say in this situation with this family, and I believe I was talking to Merced and some of the staff, and with this one, they gave them a recommendation for LIHEAP, right? Because they were having energy assistance issues. So you can literally put almost anything other work that you do. And this is just our ability to track what other services that you're giving to them. So let's say on this one right here, it's always going to be DDRP because that's who's funding this program. But you have all these different type of services. If there's something that you did and you have a question about, please shoot me an email. If there's something the kind of services that you're giving them that you don't see in there, let me know, and maybe something we can add into it. But no matter what you pick in here, what's important, let's say employment services, it's going to give you, and you do want to hit the start date. Let's say you're starting this service now. It's going to give you all different kind of outcomes. What we want to start thinking about is, why am I giving somebody employment services? Well, it depends on the family, right? So what you could be trying to do is saying, oh, well, I'm working with an adult and I want to work with them so that they're currently unemployed and I want them to obtain employment, right? So this is one of my goals. You can always hold down the control button. Not only do I want them to get the job, but the goal is that they actually keep the jobs for 90 days, right? So you can select multiple ones of these if you want to. But we want to set that goal. We want to set that outcome. That's what you're trying to achieve. Now, do they achieve it at the very moment that you are working with them? No, but you're setting that goal for them to achieve later so that you can go back towards the end of it and mark whether they achieve that goal or not. Okay. So there's a start date that doesn't need to be an end date if it's an ongoing thing, right? Then you also have the service type. So all these different things. So it's under employment services, but what is the actual CSBG service that I gave them? So this one's an employment. So let's say you did a job referral, or maybe you're doing some resume development, or somebody is. Again, this doesn't have to be work that you're doing. Maybe you've referred over to somebody else, but you want to track that this service is occurring, right? This is really showing that you're doing the wraparound services. So almost every type of service that you can think of should be in there, whether it's childcare, whether it's housing, whether, here's the childcare one. So what's the goal with it? Well, obviously, if it's, early childhood education, the goal is for school readiness, right? So you have all these different goals that you could put in here that you're trying to help the family achieve. And then most importantly too, is what kind of service? So Eric, if you guys send some folks over to your Head Start office, right, you'd put it in here and that would show that this was the referral. And then you can always go back, right? They're always going to be in here. So on this one right here, so you got housing assistance. All right, the goal was the households would maintain safe and affordable housing for 90 days. So in this family, she referred them over to LIHEAP. And so what we would do is we'll follow up in 90 days and say, hey, were you able to stay in your same house for 90 days because we helped you pay your light bill or your energy bill? And they say yes. Then, okay, great. Well, I'm going to mark that as a good result for us. And it's a really nice, cute thing right here. It says this arrow with the target, right? That's our outcomes. So they're going to click here. And after they follow up in 90 days, you can click there and then put what date they achieved it. And that's going to show two things. First of all, it's already showed that I enrolled them in that outcome, that was my goal for them, was to stay in their house for 90 days. Pretty big goal for some of our families, right? Stay in their same house for 90 days. Well, I followed up with them for 90 days and then I can mark it here and it's going to show that was actually achieved. And I'll show you where that shows up at. So I don't want to save that. It'll actually put it right here. If you marked a date that's achieved, the date would be right here under it. It'll show you the achieved date. Okay. You can do as much of those or as little of those as you want to. The goal is for us to be able to show how great we are, to say, look, these families came in and got diapers, but when Josephina came in, not only she get diapers, but we referred her over to our other office and she got LIHEAP services. And then I followed up with the LIHEAP services to make sure that they got it, right? Make sure that they received it. And you can see right here in the comments, follow up to see if they receive it. It's a little note to yourself, right? So you're going into their family service tracking. This is a usable tool so that you can go in and say, what am I doing with this family, right? because I'm sure everybody memorizes every single family. You guys are better at it than I was, but this is a tool for you to, when that family walks in, it's just like walking in the doctor's office and you say, hey, can you please read my chart before you walk into my room so I don't have to answer all the same questions again. This is the chart, right? This is their well-being chart. You can track all of that. Any questions on that? All right, I want to show you a couple other things that'll help you really pull out the information. This little button over here called PIR or CSBG reports. If you have Head Start, you're familiar with PIR. This is one of my favorite ones. When you click on this, and I'll just click, it'll take just a second because it's a lot of information. For any of you that work on the CSBG side, it'll look familiar. We just use that same report because it's a little bit easier for us to see what's going on. And we didn't really want to recreate the wheel when we talk about what kind of outcomes for our families and what kind of services they're getting. So first thing is, it obviously gives you all the characteristics. So you can run this. You can run this at any time so you know all about your families and what's going on. You see how long it took me, 5 seconds, right? And if you click on this, I say 418 males, it'll tell me exactly who they are. It's all right there, right? Real simple and easy. So you can go through. One of the things I want to show you too, the characteristics are great. You can use this data for yourself if you're trying to make some decisions on some different programs you want to run. But you'll see here, all these numbers here will populate automatically when you put that family service tracking in. So again, there's two different things we're trying to do. First of all is how many were served. So if I have a family comes in and I am, again, that goal was for them to get a job and then to maintain that job for 90 days, I may have started that target, that goal for them. And these other services that I gave are what I'm trying to get for that outcome. Well, the first thing it'll do, it'll enroll them here and it'll show a 1 or 2 or 10 or however many families you got here. And then when they actually achieve the results, it's going to put it right here automatically for you. So you can run this for yourself. And if you say, okay, what 10 families am I working on? You're able to click on that and it'll automatically tell you, and it helps set all that and do that for you. So you don't try to have to memorize what 10 families. So you see here, the family I showed you earlier, it's the only one in on the households who maintain safe and affordable housing for 90 days. So I have one that's out there, 0 achieved, but it reminded me, okay, Josephina, yeah, I set that target for her. I set that goal for that family, but they still haven't achieved it yet, right? But it really easily gets me back there. One other quick point I want to show. So here are the families. Again, we're going to track the diapers, and I'll show you the services where the diapers are at. But again, why are we giving families diapers? Well, we want individuals who demonstrate improved physical health and well-being. So currently, out of all the families we have in there, only 248 have that. So one of the things I'll do is go through there. And I may reach out to you and say, hey, I see that you got this family in, you started giving them diapers, but you didn't set that outcome. Just can we go back and fix that in there so that it's not me having all that in there. You want to be able to have it. But you can see here, all the families currently that have that outcome set. Now, I do see that there's currently 35 already marked. You may have already assessed that, but remember, one of the things that we tend to want to do is set an outcome and then immediately mark it as achieved. But we need to have a realistic way to do that. So if these 35 belong to you, you may want to go in there and unclick that as achieved right now, because we really haven't put a survey out to say, you know, does your child have they been able to demonstrate improved physical health and well-being? Okay, and we'll have a system that comes out. We'll set that up. We're at the very beginning stages. There's no sense in doing the follow-up assessments this early, right? So we'll talk about that in later meetings when it comes time to start doing that. Again, you only see 14 here. That's where you're going to start to see all that case management. So when everybody goes back in and puts that case management, you're setting that target of the participants served in the program. I want to jump down here and then I'll come right back to you, Emma. So the next piece is services, right? So this is the services that are all set. Obviously, the biggest one that we're giving everyone, I see there's a rent payment. Somebody's documented that they've helped pay rent. So those are good. All these services will show up as you start to do them. So you'll be able to see what else you're offering. So right now, currently, we have 234 kits and boxes. All right, so that will automatically mark when you're doing those diaper sizes. And see what is good about this is an unduplicated family count. It's not how many kits, and I'll show you where that's at in a minute. But currently right now, there's 234 unique families. I know we've actually served more than that. We just need to go in and clean all that up. But you can easily run this report for yourself and you'll be able to see every single family, and then you can look at it, compare and say, okay, which ones do I not have in there? I need to make sure you get all that in, because again, this keeps you guys from having to send us any reports. If all the information's in there, I can pull it up. But when I pull it up now and it says 234, I'm like, well, somebody's missing. because when I go and look at the data system, I see, more folks. Again, eligibility determinations, why it's key to put that in there is I only have 44 now, but I know that we're serving closer to like 500 people already. If that's the case, then this should be closer to 500. So we need to make sure and get all that eligibility determinations in there. Emma, you had a point to make?
Yes, if you go up a little bit, please, to the NPIs.
Yes.
I don't know if you noticed, but when you put the amounts, you see how it says 244.48, and then there's a target. So if you want to also set up on the settings, David, you want to put out what is the target? You can do it at an agency or a grantee level, whichever you want. That way, the system will automatically calculate that percentage of how much you achieved so far. So the target is very important because like you're shooting for 500 maybe or 1,000. So that way, okay, out of 1,000 families that you're supposed to be serving, you only have served 248, and this is the percentage that you currently have. So if you want to include that we can also do that for you.
Absolutely. Thank you. Thank you. So again, on this real quick, if you just go over to the side where it wasn't so
Family reports.
yeah, thank you. So when you click family reports, where was the CSB? Oh, here.
Oh, the PIR. Yeah, sorry.
Yeah, that's it. The one we just did, it's just the 990 EN, right? So you just click PR, CSBG reports. That's where you get all that info. You guys have access to all that information. You can pull all that when you get ready to run your annual reports for yourself. You can pull that down and send it to your planners to say, hey, don't forget our families. We serve these folks too. So it's all in there already ready. But family reports, this is the fun one that we use too. And it is family services tracking report. So if you click on it, 1011, family service tracking report. It'll give you every single family, all the information that you need. You can track it. You can click on the family. It puts it all in one place for you. As we go back and start adding the values in there, it'll start showing that as well. But the one I really like is the family services item statistics or family services statistics. Both of those work really well. So when you click on that, bam, right there, all the services that you give. Real quick. So that way you'll know, who's in, who's not. So when I run this now, I see 574. Okay, that's not too bad. Again, we'll figure out this, but I look at number of families, 517. So I'm comparing both of these. I'm knowing that I'm serving 517 on the services. Maybe I need to go look at the outcomes in the CSBG side of it as well. But this really takes a quick dive into it. And it'll give you an idea of all the services that you've offered so far. If you want to see your service items, it drills down to those items. Remember, we're putting those in there. So you can see it here as well. So that's an items report versus the other one as well. Questions on that? These are just reports to help you. I just want to be transparent. This is all I'm pulling. So I'm not even really looking at your family data. I'm clicking on that, pull that down. It lets me do my report. I click the CSVG. It lets me tell the story about what we're doing. So I want to open it up. I went through a lot of that. That's the big items that I see so far. What questions are there? Do you want me to explain it again? We can go back through it. Any questions on COPA? Go ahead, Eric.
I guess I have a couple of questions if anyone else doesn't. Because you mentioned the kit is $20. Is that are you guys gonna have autofill, or do we have to go back and enter it for every kit we're given? I just want to confirm that is the price of a kit.
If you'll do it going forward, I'll clean up the old ones for you.
Okay.
Yeah.
Going forward, we're gonna enter $20 per kit, right?
Correct. Yes, that's the number we're going to use to look at the value.
Okay, and then I'm looking at the services, but we both ISKN and the OASIS, we provide a parenting class. Quite often we have parents in those classes that have babies in diapers, so they are receiving adult education on top of the diaper. Do we put it as basic? Because I'm looking. Do we put it just as basic education classes into education adult? because I don't see options for parenting.
Let me check. So like parenting classes, is it parenting classes or just,
They're nurturing parenting, you know, DHS approved, it's court mandated. That's why if we want, it's more than it's very specific. So, but the only option, the best option I see in there is basic education, unless I'm not seeing. I can share my screen.
yeah, go right ahead.
Like,
Let you.
share. Can you see my screen here?
Yeah, it's coming up. Yep, there it is. Yes, sir.
So you have all these options, like English and post-secondary and whatnot, but I don't see anything that relates to parenting. Do I just, will we just click this one?
Let me. I don't remember where I put it.
Or is it? Or is it another program type or a service type?
There's one under childcare, early childhood education. I'm trying to decide, but that's parenting supports.
That would be a better fit, I suppose.
Would that feel better? We can do that.
Okay, so
Great question. Yep, that'd be a great place to put it.
okay, on my can you show again, because I didn't, where the surveys we want our parents to do, because I didn't quite catch that.
Very top right there where it says family assessment. Oh, are you talking about the BES survey or
The survey that the parents have to complete themselves.
Yep. So when you sign out, if you click the sign out button,
So I sign, okay.
and you see that right there, BES Spanish, BES English.
Okay,
Yep, the links will always be there.
okay, and then so. Well, ideally, we should have them do it while they're here, right?
Correct.
Because it's pretty quick.
Yep.
Okay.
Is that good?
Thank you, appreciate it.
Yes, sir. Maureen, you got your hand up.
Hi, yes. I had a question around like income. If we have someone who has zero income, are we able to enroll them? Like some people are working under the table or I'm in between jobs and aren't receiving a subsidy at the moment. Are we able to enroll them?
Say that one more time. I apologize.
Yeah, no problem. So we have some people that are reaching out that don't have income. They're either working under the table, so it's like informal, or aren't receiving a subsidy at the moment. Are we able to enroll those folks? And like, what type of proof would we provide?
We're simple, you know, a letter that says I have no income and I test that I have no income and they sign it and you scan it into eDocs, that's fine.
Okay,
I'm
great.
absolutely simple about no income, yeah. So,
Okay, perfect.
yeah.
Thank you.
Now let's don't everybody say, I don't need 1,200 no income statements. We're gonna look a little rough, but yeah, if they claim that they have no income, then that's fine. No household income. Yep, just a letter that they're attesting to that is fine. I've not been told we can't do that, so we're gonna do it. Annie, is that your only question, Maureen? I'm sorry.
Yeah, thank you.
And I'm working, and I did reach out to the feds about y'all's other question about qualifications, and somehow I'm not getting a response. So I'll keep beating on them to get it. So go ahead, Annie.
Yeah, just to go off on Maureen's question, I noticed on the application, one of the fields is required, which is the primary type of public assistance documentation. So I'm just wondering if a family, you know, if they don't receive TANF, SSI, or SNAP, does that mean they're not eligible to even apply? Or do we have to make a selection on that question?
No, you do want to make a selection either yes or no, but if they say no, those are just automatic qualifiers too. So if somebody's receiving SNAP or CalFresh or WIC, I know Merced's using WIC, right? Is an automatic, you know, we've already got their income for them to qualify for WIC, so let's don't do it again. Is that answering your question? So on the front page, it's a required question.
Yes, that does. Yeah.
But you can put no in there, right?
I think so. I gotta check, but I'll keep an eye on it. So thank you.
And I'll follow up with Emma to make sure if I'm, yeah, you should be able to put no, and if you put no, that's fine. It's just giving us data on how many families. Because what we'll do is be able to say, you know, out of the 1,200 families we served, 900 of them were on, you know, SNAP. You know, and really, you know, just help us tell our story about what our families really are, the ones that came in.
Okay, thank you.
Thank you. Great question. Is everybody okay or feel familiar with the eDocs button? I do want to hit on that for a minute. Okay. So let me share again. So there's a button here to the right. It's called eDocs. It's also right here, eDocs right here. You can do family. So essentially, let's just use this. And I'm just going to pick the same family we've been picking on. So right here, these are a couple different ways to do this, but really all we're trying to do is keep all the documents in one place in case somebody does come and check on us, so that you don't have to keep it in a separate paper file anywhere. This is just a way for you to take a picture of it, scan the document, whatever you want to do, and then you just upload it right here. So you do eDocs, you have your family. If you're on a certain family, you know, all you're doing is just uploading those documents into that and just trying to tell us what that, you know, what that document is. The other thing I wanted to show is, and these aren't the best in the world, unless you have the right things, but right here, when you use that lovely case history button that I like so much, as a family comes in, this will just keep updating. And you have a really neat feature where you can hit add signature here. And I'll make sure I'm gonna do that right. I may have to check with Emma on how to sign that the best, but once you sign that stuff, it allows you here to hit this eDoc button. It looks a little different.
Okay, go ahead and click on the signature pad again.
Sorry.
And then click on the first one, touch screen, and then click on submit.
Oh,
And then
right.
there's a little box. So you must click on the link on the top, the eDocs link, to save the signature. Click capture.
Yeah, sure.
And then there's a signature on the bottom. So you must select
Everybody see that? Signs it. And then-
right there, eDocs. And then if the family apply via the parent portal, then they will get a copy automatically of this. If that's why it's asking you, do you want to share this with the family? If you don't want to share it with the family, that's fine. And then you can just say, yeah, save it into a PDF format. And then you will just save it. And will go straight to the eDocs document. And then when you click on the family's name, if you go to their data sheet, the document will be always there following the family everywhere she transfers to. See there's the link. Go to the top. Go to the top. On the right hand side, eDocs link. So every document that has been saved, it will be right here.
So if you ever see on a page, and again, that is just something to easily keep the documentation. Again, you notice there's no printing there, right? You're clicking that add signature. They can use the mouse, they sign the best they can. Doesn't have to be pretty. And then you just hit that eDoc button and it saves it as a PDF. You're not printing it off, putting it in a file or anything like that. It'll just share there. So other things that you're using for documentation, whether you're taking an ID or maybe it's their WIC enrollment, you can just scan in their WIC enrollment, put it in here, and that way it's there. So if anybody ever comes in and says, well, how did you verify this family was income eligible? I don't have to come out, pull your filing cabinet open and go through all the files. They're just here. So as you get time, it's just a storage, it's a cloud-based storage system that ties it right to the family, and it's all there. Use it as much as you want. Anything else you need to store in there for the family, you're definitely more than happy to.
And we are the only agency out there that is HIPAA compliance in regards to the signature. So you, if you don't have a scanner, you can just take a picture from your smartphone or from a tablet. You log into your calcapa.mycopa.com and go to the family, and then the system will tell you, do you want to take a picture or you want to use your photos? So if you select, I want to take a picture, that picture will automatically get uploaded into the family data sheet, and it will not stay on your phone. Okay, it would automatically be uploaded and that phone would, I mean, that image is not gonna stay on your phone. So that's a lot of security that we have. But again, you have to be logged into the CalCOPA database and take that picture from there. Because if you just take a regular picture, then that picture is going to stay on your phone. Does it make sense?
Yeah, so we used to use that feature a lot when we were more mobile or, you know, we're working with other folks. And then the parent portal works very good on the mobile side as well. And allows them to take pictures and upload all that. So again, I'm not, we're not, well, I've got to see the real ID and I've got to scan it on this scanner. No, if they can snap a picture of something that you need and upload it into their parent portal, it'll upload into their, it'll allow you to pull that over really, really easy. We used to use it out in the field all the time where we, you know, folks had phones, they take a picture and it automatically upload into the eDoc. It made it real, real simple. And again, like Emma said, it's not storing on your phone. I do encourage everybody to take a chance and look at it on the mobile version because it's really neat how quick you can do stuff. And it helps you explain it to folks if they do have a phone and they're, you know, you send them the link and say, I'll just pull this up on your phone and you can, you know, apply right there. You don't have to come in. So. Any questions on that stuff where we're at there? I want to touch on a couple of things.
Can you show the signature again? How to do the signature?
Yeah, so a couple different places, but the biggest thing is when you click on case history, it puts everything together, what you've been working on. And then there's a button right here. It just says add signature. When you click on it, you say touchscreen, you submit. And then when you sign it over here, you do have to hit capture signature and it'll pop it right on there.
Thank you.
And save it and click on eDoc.
You have to click eDoc because it's going to save it. Because if I go away, like if I go here, if you wanted to, you know, this is the application here. You can, you know, all that. If I click away from it and then I go back to case history, right? Well, the signature is gone because the signature not going to stay on that page. It's a moment in time if you're wanting to have that. When you do the application, same way, you'll see that same thing at the bottom of the application as well. Is that correct, Emma? When you do the original application,
yeah. So if you go up to the sub tabs, see where it says family reports, family report right next to family service tracking. You can print the application. It says family client application is right there in English or Spanish.
Oh, yeah. So yeah, when you put in that application, right,
and they can sign the application too. So that's also great.
Yes, that would probably be the biggest one we'd like to see in there. So you've put all this information in. You can click add signature here. I know we had a couple questions. Maybe was it you, Anita? That Emma, is there a way if Anita fills this all out over the phone or they do some of it, they can sign it through the parent portal, correct?
Yeah. So once the application is submitted, they will be able to on their portal. They will be able to submit it and sign it.
Okay. So you have all this information in here for them, and the first time they come to pick up diapers, all you'd have to do is click, you know, add signature, submit. They're going to sign it here, yada, yada, yada. And
they will share it in the parent portal.
They
will get an email notification saying that you have a message on your portal, and that way they can go and review what you had just shared with them. So that's like another great thing about having them apply through the parent portal as well.
So once they've done it, or if they're in their office and you do that, again, don't forget to hit that eDoc button. And I'm not going to share with the family, but I can go back and delete it, I guess. So if I say yes here, that's there. And then I'm going to say,
you just go back to the data sheet and it's right there.
So eDocs, see the files there. Didn't have to print anything, didn't have to put it into a file. It just had them sign it, but you'll forever have them signing off that this information was correct. Can we delete that, Emma?
Yeah, so if you go, what's the name of the family? Josefina. Okay, so click on the X on the top right corner and then go to eDocs. The eDocs, and then go to document directory. No, go back to eDocs.
All right.
Document directory, and then click on family.
Gotcha.
And then all categories. And then you have that, you can go to Josefina and delete the document. Delete on the right hand. There you go.
Does that make sense? I'm gonna stop sharing for a minute so we can all see each other. Are we good there? So again, the eDocs is really, so you can have them sign off that this was correct and put that on there, and it'll save that file forever. So
Sorry, what's the link for them to start completing things on the parent portal? Do we share the same link, or
Are you
what
are you gonna add that link to your webpage, David? Or you can just copy that link and put it in your social media or everywhere, wherever is more convenient.
So yes, to answer your question, forgot who asked that question. Marie. So when you sign out on that homepage, it's there, and you click on that parent portal. Yeah, because what'll happen is, I've already created myself an account, but they'll click on register, right? They're gonna consent to this. When they fill that out, and when they select what county they're in, it's gonna come to you.
That's great. Awesome.
Yep, so Sandy's not getting all yours from Urban Services down in Merced. It'll only come to them. And so one thing I wanted to show you when they do that, so they're creating an account. I mean, they're creating an online account. Where you're able to find all those, just so everybody knows, is when you go to family.
No, you go to the enrollment tab, enrollment, and then eligibility recruitment list, family recruitment list.
Family recruitment list, did you say? Oh.
Yeah, right there. And that's all, that where you're gonna see all the application that has been submitted online.
Now I can see everybody, but you'll only be able to see yours, and you'll be able to pull it up. So here's one from Merced that somebody filled out, and all you need to do with that is
put a checkbox next to the right there, and then convert it into a regular application.
So it'll pull all that information over that they filled out, saves you a lot of time because they filled all that out. But yes, short answer is that link is the same for everybody. And like Emma said, I mean, definitely feel free to put it on your website so they can just click on there and start the process for you. We use this pretty heavily during COVID. Folks could go in there and fill all that out, and you'd be amazed at what you could do without even talking to somebody. And some of our parents really enjoyed that. I don't want to talk to you anymore, David. Okay, fine. Any questions on that? Okay, I'm gonna stop sharing there. I want to answer any other questions that we have. Just a couple big things. Reminder, our target is 300 ongoing families. So yes, in theory, if you have a family drop off, then you want to try to add another one at that point, but we're just trying to keep a caseload of about 300 families for each one is our goal. If you're having trouble with that, please let me know. If you got income qualifications, questions like that, please let me know. The other thing is our goal is to ensure that everyone has enough diapers for the month. I know Supply Bank has recently told me that they're working on getting the donated diapers in too, so that you have additional above. Oliver, correct me if I'm wrong here. I hate to put you on the spot, but our thought is that each family is getting 2 sleeves of diapers. Is that correct?
Yes. So each case of diapers can be divided in half, and 2 of the packs or sleeves will be given to each child.
So each delivery really is 150 cases, but would serve 300 families a month.
Well, the math gets even more complicated than that, David, because there are wiped cases on top of that. So you will get 150 cases of diapers plus the corresponding number of wipes that will make the kits.
Okay.
And I know that is very confusing. It's confusing for all of the sites that we work with. So if there are any further questions on that, I'm happy to connect.
Good. Yeah, feel free to reach out to Supply Bank if you want to make, but again, the target is that we're trying to reach 300 families and making sure, and then they're doing a good job of hoping to get additional diapers so that we can make sure that families get through that. Another reminder, our biggest target over the next couple of months too is to make sure that we continue to have folks fill out the BES, the benefit enrollment survey, that this is, for lack of a better term, this is what's going to pay the bills. That's the information they want. We believe all this other tracking that we're doing is going to be show a very, very robust program. So I appreciate all that you guys are doing on that end. Other questions or things that we haven't hit? Yeah, go ahead, Eric.
But to confirm, they can come twice in a month, right? We can leave them 2 kids per month.
Well, you still want to be able to serve 300 families. So if you're giving them 2 full kits, if you're giving them essentially 4 packs, you're probably not going to have enough for them to get through that, because we want to try to reach 300 families at this time. Now, if we start seeing an increase in the diapers through the other donated diapers, but currently our budget right now is, and I forget what's in each one of those packs. Is it 40 diapers in each pack? I'm trying to remember.
That's correct.
Yeah, 40 diapers. So it's really 80 diapers is really what we have budgeted right now. And until we get some more information about some of the other additional donated diapers, but that's really what we're at now. The goal is that they have enough to get through. And again, I don't know diapers enough to know how many you need in a month, but
with a smaller baby, with a smaller size, when a young baby, they tend to, the 2-pack doesn't last no more. That's what we hearing a lot from a lot of families.
Well, I'll have a conversation with Flybank and see, and then maybe some work that we need to do to try to get you guys additional diapers so that we can try to extend that, because the goal of the program is that they have enough for the whole month. Or if you're seeing them every 2 weeks, then really you would only be giving them 1 sleeve, and then 2 weeks later, see them again and give them another sleeve. And part of that was if they don't have good transportation, they don't have a way to take all that back at once, then we want to make sure that they don't have to take it all at that time. From what I see, it looks like we could probably get both sleeves and the wipes home. It's total. I would rely on you guys to tell me if I'm incorrect in that, but.
From what I've heard from our programs department, it should be manageable to carry all at once. You could even put it in like a grocery bag, need be. I was going to ask a related question, because this is something that came up in our one-on-ones with the respective sites. If you're a site who does not have the 300 families already ready to receive diapers, and you're receiving these shipments that exceed the number of families that you're currently serving, what are you to do with the excess diapers that you have? So in Eric's situation, if you have extra product on hand, is that not on the table for them to distribute?
No, it is. And I think that's currently, until we get to that 300 max. I mean, because we know at the end of this, we have a very finite number of diapers that will be bought and sent. And so the goal is to, get them all out. It's just making sure that, that you do record that in the COPA system. So if somebody ends up getting 3 packs, times $20, then we'll be able to see. So, because I'm going to I get a report from Supply Bank that says, hey, we've delivered, 1,200 packs. Then I need to be able to go in there and say, okay, well, this month it went to 800 families instead of 1,200 families, but it's because these amount of families got 3, because we're not fully enrolled yet. We don't have all 300 yet. Yeah, just as long as you're marking it on that service item that I can see, instead of just letting them necessarily sit there and pile up. Because if they pile up and it takes you a couple months to get to 3 months to get to 300, then they're just going to keep piling up, because you're going to keep bringing another, and we're going to get to the end, and it's going to be like, please, everyone take 6 packs. And we don't want that, that logically makes sense. So that's a great question.
I had a question. We have some people that are asking if there's a specific brand that is going to be distributed for the diapers.
So we have our own in-house brand that they're an ODM. So they will come with not a traditional grocery store kind of packaging, but they will say supplybank.org on the exterior. But they're comparable in quality to a Pampers or Huggies.
Okay, great. I think there was just like some allergies or something that they were concerned about. And another question, we're getting some requests for like adult diapers or like children who are older that need diapers because of disabilities, like 9-year-olds. Are there other resources that you know of that we can connect them with?
Right, that's it. But both of those are good questions on the allergies and we're working on that now to fill those gaps. If you could let us know, especially if you've kind of got like a count of what you're looking for. And then CalCAPA is going to try to work with our partners to meet those needs, because we don't want anybody to just be excluded because of the allergies. But it's reaching out to other partners to figure out, hey, who can help meet that. So we'll be working on that. And if you got kind of an idea of a number, this is for all of you, of very specific cases, then please let us know. And that gives us kind of ammo to say, hey, we need some help here on this, this, and this. And then we'll figure out how we can get them to you.
Can I add one more note on that, just because it comes up quite a bit? We test all of our diapers. Every purchase order that we get into our warehouse, we send packs to be tested. So all of our wipes and diapers are microbial, allergen, and heavy metal tested.
That's great. Thanks for throwing that in there.
That's great news.
Jasmine, go ahead.
Hi, so I was going to touch base because I have a question that's really similar to that one. She stated that the diapers for the older children that are, might have a disability or have an issue with that, will we be supplying like pull-ups for those who are transitioning out of the size 6 for the younger toddlers, kind of going to that are cross between the 4 and the 5 that are potty training and they just need pull-ups instead of diapers?
Yeah, great question. We're currently not. I mean, our program is very specific where we're trying to maximize, but yeah, I mean, the sad part is at this point that we just age out of the program.
Okay, thank you.
We could, we'd love to do that. The issue is the funding was cut about 300,000 from what it was originally supposed to be. And that really, especially here in California, that makes it very, very difficult, And just so you guys know, we did advocate pretty hard because we said, look, no offense to, Virginia or something, but running a program here is a lot more costly than running a program in, my home state of Mississippi, I mean, it's just the cost effect. So we are trying to advocate for that, to say it's hard for us to run the full robust program, but it is very, very specific. So, but this is really good feedback because it helps us advocate for a more robust program and to understand how that can work all the way through. So, Annie, I see your hand up.
Yes, I have 2 questions. One is I'm getting a few questions regarding the formula, whether it's powdered or liquid, and then also, the same question of like some babies might have an allergy to a certain brand. So I just wanted to get a little more detail on that. And then also my second question is regarding enrollment, where some of the mothers who are calling are kind of expecting their child, not yet born, so prenatal. So they're just asking about eligibility and what enrollment looks like for that.
Yeah, absolutely. I mean, they're 7 months out. That's going to be a little tough because that means we're holding a spot for 7 months that, without being able to deliver diapers. So that's a little tough. We don't really have a cutoff, but absolutely. Yeah. I mean, if that's who you've got, and it may be a situation where you go ahead and take their application, you put them on the list. And if there's somebody else in the meantime, and then, hopefully somebody else rolls off by the time they have that child and you're able to enroll them. I mean, we are trying to keep the same families the best we can over the whole 18-month period to show that if you have a long progression program, it works better than just a one-time deal. But yeah, absolutely. I mean, especially if they already have a child that you're already servicing, can they get that other child on there? Absolutely. Yeah. And I think if you go ahead and have that application in there, then to me, it shows, how many of those we have waiting. So if we're trying to serve 1,200 families and you have 300 yourself, you're trying to serve, if you have, 30 to 50 that are expectant mothers, sure. I mean, I don't see an issue with that. Did that answer your question?
Yeah, and the second question is just regarding formula, whether it's liquid or powdered, and is there a specific brand that we have?
Oliver, I'm gonna punt with you. Is that something you guys are delivering as well? Maybe through a different program?
We are only delivering diapers and wipes.
Okay. Annie, I'll check with you afterwards to see maybe where you guys are getting that from, because I don't think that's coming through this program.
Okay, got it. Thank you.
Any more? Yes, go ahead. Marino?
Oh, yes, Monique, sorry.
Monique, yeah.
Yeah. My question is, if we're distributing every 2 weeks and does the next pickup have to be exactly on the 2-week mark?
No, it's really, family based. When do they need it? How often, again, our goal is as long as you're able to serve 300 families, as often as little, I mean, you don't want them coming every day. 300 people showing up every day would be a little.
Right.
What is,
Right.
it's all about what's comfortable for the family, what the best is. It's just making sure that you're looking at the amount of packages that you have, and that you have enough to serve all 300 families. That's the goal.
Okay, thank you.
David, I have a quick question regarding eligibility. I had a family a couple of weeks ago and they were inquiring on eligibility. They have a minor who is 15 years old and she does have a newborn child, but the parents do not qualify, but the minor does not have any income.
He's in the household with the parents. They don't qualify income wise.
But they're still being supportive parents and keeping her and the newborn in their home. And
well,
would like to know if the minor would qualify for the diapers.
One second. One second. Great question. Other questions? Yeah, don't hesitate. If there's something you have a question, just shoot. We are in the process of bringing on another staff. Melissa was with us to kick it off, but she's kind of went part-time, had another offer back at her previous agency. And so she's working with them more, but she is helping us keep things afloat. So definitely just email me in the meantime, and we'll try to get them answered as quickly as possible. I'll be going through the data a little bit, so I may reach out to some of you guys. But again, our goal is to get everybody in, start having, hitting that 300 mark on a monthly basis, and then go all the way through April the best we can. So that's our target. As long as Oliver keeps sending the diapers out, we'll keep rolling. If you have any questions about intake, please reach out to me. Again, we do have a report that's due right after January. So I'll be pulling all that on January 31st. So if you're looking for a date to have your data cleaned up and everything in, that would be a really great date for me. So that I can go in and pull that on February 1st and start cleaning through it and making sure that we can easily report out what all they need without me having to bother you guys. So anything else? So biggest thing is diapers, getting the assessments, and then starting the wraparound services and what we're doing and being able to track that. So, any other questions? Was this helpful at all? We're able to do this? Okay. We'll send out a message here pretty soon about trying to get something later in February, maybe middle of February, so that we can all hop on and see if there's any new questions or new situations that have come up. Well, I have about 2:30, so we got about 30 minutes I can give back of your life. So I know everybody needs it. So thank you all for being here. Oliver, Emma, thank you guys for your support and for sitting through and helping us answer all these questions. Okay, talk to you guys all later.
Invitation.
Thank
See
you.
then.
Thanks.
Thank
Bye.
you.
Take care.